Um, welcome, come in. My name is Ruth York. I'm the Executive Director of Families and Youth in Idaho. You see us up there. I have two co-presenters with me today. You will see both of them in time. Michelle Batten is our Family Engagement Director, and Rainey Bowles is our Board President. And we're here to talk about what's happened in Idaho in terms of our ability as a family organization to bring family voice to our state mental health system and how it affects policy in the state. I am not here speaking as an expert, like here, you just need to do it the way we've done it and you're gonna be good to go, because we're gonna share both some successes and failures. And really, I just felt compelled to be participative in this conference, and they ask federations to come and bring a topic. And so this is the one we're bringing, but I'm hoping some of you can also speak to experience in your states. People online, you're welcome to do some chatting with us and tell us what you'd like to hear more about, or make some comments that we can share with the group here as well. Usually I'm really informal and I do a very interactive session, but since we're streaming, I'm just going to try to be careful to be both inclusive and make sure that people online are having a good experience as well. Okay, so family voice in system and policy making. Just to go over our learning objectives again, understand the incentives that bring policymakers and family members to the table together. How can we message the value of family voice to policymakers? And why would we pay parents? That's what we do in Idaho. Why pay parents to provide consumer input when they are willing to do it for free? So I just want to talk about that, because I don't know where you are in your states in terms of, do you have any paid parent involvement? But we're lucky enough that we do. That's one of our successes. And we'll talk to you about why we think that's important, and a little bit about how we made that happen. I'm just 5 years into, a little less than 5 years, working with the Federation, with our Idaho Federation, and even knowing about federations. I come from lived experience, and in my own journey, I didn't find the Idaho's Federation. Family and Youth of Idaho was new to me about 2 years before I started working there, but my children had mostly aged out of the system and services at that point. So I'm just really passionate about the work of a family organization, in part because in retrospect, I needed that. And I realized, I knew I felt kind of isolated on my journey, and really just finding my own way through as best I could, which didn't feel very good at all. And so to have the chance to bring my own voice to the work and then be all about an organization that's what they do, I realized it just feels like a good home for me. So, and anytime you have questions or please comments as we go, just throw them in. We'll repeat them for the people online, and we'll keep going. But it is my goal for this to be a bit interactive. Okay, oh, sorry, I haven't been advancing. Yes, you're advancing for me. Thank you. Okay, I think you're at a different place. No, okay, I'm supposed to be where you are. Okay, what happens when family members are not at the table when policies are created? If you have any examples of these, I'd love you to share them. But the risks are that there are unintentional burdens to families, even when legislatures or whoever is creating policymakers are creating policy out of a very well-intended place. If there's not the family voice of the people who are going to need the policy, supposedly benefit from the policy, then we're really at risk of that policy falling flat and not hitting its intended target. So as you can see, bullet 2, policies can miss the intention they were created for. And then policies can also not be equitable across all families. They're intended to be for all families, but as they play out, because they didn't have a good representation of various families, diverse families at the table, they end up being favorable to one type of family over another sometimes. Do any of you happen to have examples of that in your states or in your work? Yeah.
Yeah, this was
We're going to bring you a mic just for the people online, if you don't mind. Since we're a small group, we can do that.
Hi. This is some national work I was doing through the Building Bridges Initiative. And so we were setting expectations and standards for how soon after youth enters a residential treatment program, because Building Bridges works with transforming residential. Should there be family contact right at the start? And yes, there should, but we wanted to put in place a standard that would be basically an expectation that families have to have time with their youth and a visit with their child within 7 days as a requirement, as a mandate. And so we did have family members at the table, fortunately, and it was a big debate with one or two specific people who were more like the leaders, I guess. I was one of the leaders, but I wasn't one of those people. And if we're really doing family-driven care and we want to be equitable across long distances, then we got to work with the family. What do you prefer in terms of contact with your child once they enter a residential treatment program? Some families may want contact from day one and every day, and some families may say, hey, look, we just need a breather. We need to go chill for a week or 2 weeks. And so the intended policy actually didn't happen, and this was an example, because the family voice was at the table, and I as a provider was saying, we really can't do this, but the family voice is what won the day, not the provider voice.
Thank you so much. That's a great example. I've been working with a family recently who they're looking at a facility that's in a different state for their youth, and it was a similar situation. The facility says in all of their material, here's what the family must do. And the family felt like, well, then my child will fail there because we as a family will fail. And because we just cannot meet what they're saying because we're too far away to meet the requirements. My guess is that we can figure out a solution, and that the facility is not even aware that the language they're using could be turning people away. Because in this mom's case, she was like, it's not possible for me. And you know, she's under a lot of duress right now. She's not in her best problem solving mode. So we can kind of stand beside her and help and say, well, let's really figure out if the facility maybe has some breathing room for you there. But again, when we put things out, we have to be so careful about our language. And then we've got to make sure that the policies are not going to create barriers for the very people that we're hoping will benefit from the policy. So thank you for that example. Okay. So just briefly what we can do today. Okay, we've got a room full, okay, not super full, but full of people with a lot of experience. We're going to bring our Idaho experience. As I said, there's some successes and their failures. And again, most importantly, we're a room of people who have experience. And so I'd really like us, appreciate the first share, to share that experience, because I think that's what will make this most successful. So let's start with the ROI, and ROI in this case is return on investment. Not to be confused with, what's the other one? Release of information, right? Somebody told me, ROI, what are you talking about? Parents can help the system use language that parents understand. So just like when I'm saying, let's start with the ROI, if I don't tell you, here's what I mean by ROI, then maybe we get off and we're just totally missing each other from the very start. That's a voice that families can bring as the system does their system speak. Families can help them define and use words that either acronyms that then they get familiar with and they can buy into, or they can help a system create more friendly and family friendly or youth friendly in the case of youth mental health language. So for example, I worked for a hospital prior to this job, again in family support services. And from the moment you walked, you were admitted to the hospital, families and their youth, a person in my department, so I had several departments, this was discharge planning, was supposed to go in and start talking to the family in that moment. I mean, their first hour about discharge. And that is just so alarming when you've just gotten somewhere and they're already talking about how you're going to get out of here. And so we changed that to be transition planning. And in our youth mental health system of care, we're trying to change the language to transition planning, because I understand the need for talking to parents early on about this. But I mean, I know for me, my gut reaction is going to be, I'm kind of turning my ears off to your discharge conversation with me right now, because I am nowhere near discharge in my head. I haven't wrapped my head around admission at this point. So that, you know, but if they came at me and said, we're going to be following this case and want to talk to you about the transition planning, then I'm going to feel, okay, that feels better to me. Because number one, discharge also sounds like back to home. And maybe I think we are so far from that, I'm a little freaked out that you're already talking to me about discharging to my home. Whereas transition doesn't necessarily tell me what's next. So I don't think that the people talking to me about transition have a fixed notion in their head that my child is transitioning home and transitioning home soon. It could be transitioning anywhere, but discharge, I get a sort of a knee-jerk reaction. And that's the kind of language we're trying to keep out of our system, and trying to get policymakers to understand that that matters. And they don't pick it up because they've been hearing it forever, right? Hospital didn't pick up, but we do. That's what we do. It's called discharge planning. It's always been called that. But once you give them that perspective, they can hear it from a little bit of a different place. And I think those are the seeds we want to plant. Okay, let's move on a slide. Continuing return on investment. Parents can help systems create a good glossary of terms. So for instance, replacing discharge with transition. And then if the system can really try and embrace using these terms consistently, using them accurately, it can make a big difference to families over time. We can try and help systems limit their use of acronyms and terms that just don't have much meaning to families. Now, I will tell you, in Idaho, I don't think we're doing a good job of this at all. And what's kind of really sad is that then even as a family organization, we start throwing around the acronyms and forget to define them for our families sometimes. So it's such a bad trap to get into. So I'm just going to caution you against getting familiar. I mean, I actually felt kind of good when I finally got familiar with all the acronyms, but I never should have really allowed myself to get familiar with them, because now I just use them in front of people who are not familiar with them. So that's a real trap that I advise against. And then family engagement in systems and services is always improved if families understand what you're really talking about or what your service really is. For instance, if somebody says discharge right off, as I said, I'm turning my ears off to that. But if they talk to me about transition planning, oh, that's going to be really important to me, and I'm more willing to engage. All right, next slide. So parents, what do parents bring to the table if you're trying to make an argument for why does your system, health and welfare, your legislators, whoever it is, your juvenile justice system, State Department of Education, why do they need families at the table? Families bring so much. It's not just our lived experience, though that is, to me, the most important thing that we bring. Helping lawmakers understand that these are the people, number one, who put you in office, or tried not to, depending on the case, but number two, who are going to be the beneficiary or not of the policies you're creating. That voice is important. If you're going to learn how to serve your constituents, you need to listen to your constituents. So we all bring that, and I think a fair amount of lawmakers can at least respect us for that. But, you know, we're whole people too. We're not just our lived experience. We all have a whole variety of skills to bring to the table. Some people are really good speakers. Some people are great advocates and can bring other people to the cause. Some people have civil engineering degrees that can be helpful in certain types of work group discussions, or legal backgrounds, or finance backgrounds, or whatever it is. We're whole people. And so you're getting not just the lived experience, you're getting the whole person who has a lot of gifts to offer. And I think if systems can recognize that piece, we certainly put that into conversation sometimes, that it's more than just a person with lived experience. And that lived experience is definitely the primary reason that we have them there, but we're really looking at everything they can offer to the system. And so sometimes their professional training, skills and abilities really bring a lot of talent to the team. And that's why I'm going to say, if everybody else sitting around the table is there as a result of their experience that got them their job, and they get paid to do that job, then parents should too. And we'll move on to that in just a sec. So families can help systems understand the needs of their kids, and many kids who cross over multiple systems, right? So each system who's working, let's say you're in the juvenile justice system, but your child also has a serious emotional disturbance of some sort, and so they're receiving some mental health services and they're in the juvenile justice system. If I'm standing as a worker in the juvenile justice system and that's my background, I don't get that other system. I've never had to get that other system. But the family has to navigate both systems. So then if I'm standing over in the health system and I don't understand the juvenile justice system, I'm not really supporting the family in all of their needs. Great when a family organization can come along and help support a family across systems, but the systems need to be trying to do this themselves. So I think it's really important to advocate to the systems that they share information, that they learn from each other, and that they consider themselves partners in a family's experience. I'm going to say we don't see a lot of that in Idaho. We do see some people really wanting to make a good effort, but top down, it just isn't really working that way. And it's a real barrier for some of our families. It's something we need to fix in Idaho for sure. And then just coordinating the needs of kids across systems, their educational needs, and the fact that they're in the juvenile justice system, and making sure that their emotional needs are getting met. We're going to have better outcomes, obviously, if we're really attending to the whole needs of a child. And we can only do that if we're coordinating the care. And better outcomes for kids are better outcomes for the whole family, always. So we're always trying to keep our lens on that. And then parents can help systems understand how their process is working. If a part of the system, if a service, if a process is not going well for families, then what the system needs to be able to recognize that is a decent due process or complaint system. But if those are falling into sort of a black hole, I mean, first of all, if there's not a place for them at all, that's sort of a disaster. You have no way of knowing how your system's doing. Hopefully most systems at least have attempted to have a place where families can go and try and be heard and get some change. But families can bring so much to the creation of that process, so that they can be sure that the system can be sure that families have embraced that this process will work for them, therefore they will use it, therefore we can improve the system by making sure that we are offering a way for parents to tell us what is going wrong. So that, number one, hopefully in our system, what I'm not loving is that there's a good place to say this is what's not working, and there is a group that picks that up. And I even get to be part of that work group that reviews those. But the piece that's missing is to make sure that the parent gets the information that we see that, we hear you, we want to help you. We're not quite as good at that yet. We're moving in that direction, but at least we've got it going to a work group that is multidisciplinary, includes a family org. And it's a place where parents can bring their voice to what's working or what's not working in the system. But I'm going to really encourage that the piece that's really going to make it work is if the family gets connected back to say, this is what we learned from you. Sorry you had that experience, and this is how we're working. Invite the one case I saw that I really appreciated was that parent was just then invited to could you be part of this work group? Could you be a parent member of this work group? Because I think you're hitting on something that we hear a lot, and we could really use some representation on that issue. And then without a parent-friendly way to capture parent feedback and address concerns, then a system's just, they're not going to be in touch with what's happening in their own system. So we are lucky in Idaho. I mean, unlucky that it took a lawsuit but I mean, so many of you have been through this in your states, that things were going so wrong that a family had to bring a lawsuit to say the system must change. Main issue at the time in Idaho was that youth were not being separated from adults in their treatment, and there was just not an adequate or even close to effective system for youth mental health. Fast forward, takes almost 35 years to get the lawsuit through the court, and it's been about 5 years since that lawsuit settled. That has required, the settlement requires family engagement in Idaho with the Department of Health and Welfare, with the Department of Juvenile Justice and the State Department of Education, who are all defendants in the case. So that sounds great, because then it puts us at the table. And that part really is great, but we still have to fight at that table every day to make sure that the parent voice is valued. The most effective way we think to bring it is the parent themselves, like really getting parents, not just us, hey, we're here again representing what we're hearing from families. That has some value because we can bring together a volume of responses, trends that we're seeing, and share that information. But as many of you I'm sure know, when a parent is there telling their own story, that is going to hit the heartstrings and hopefully the minds of the people around the table in a different way than if it's third party related to them. So we've really seen some change occur out of stories that really hit home. On the one hand, that's great. On the other hand, it kind of bugs me that it takes that level of somebody talking through their very, very painful story that you know is replicated many times over out there. But this just happens to be one person who got in front of Idaho policymakers and was able to tell their story and have it affect them in a way that makes a difference. But that, to me, I'm just saying to you, the power of one story is really amazing. Okay, and I'm going to turn it over to Michelle, who's going to talk about how we get parents to a place of becoming champions in our system for parent voice, the work we do directly with parents.
All right. I'm going to just request that you guys check out who's online, and if you could check out on your phone.
Yeah, I've got that.
Great. Super. And we encourage the people who are online to feel free to ask questions or chat with us and input. I can. All right. It's going to be hard for me to stand still. All right. So my job, I get the privilege of being the family engagement director, and that means I get to take families who have come to the Families and Youth of Idaho and move them along into leaders. And that's one of our poll questions was, where do families start? For us, parents start at our family support line. We have a line where families can call and get help navigating our youth mental health system. And through that, we're able to collect information on them and do our data reporting to change system, but at the same time, collect information, appropriate data that they've released. But we're able to begin at that phone call and move them through this ladder of getting them to this place at a seat at the table. So that might start with the recruitment and work of advocacy is the first time they call. I am able to help them navigate or do a warm handoff to help them get them to the right place. And then from there, I have a plan on when I'm going to call them back. I do it because we're a family organization and my heart is to help them, but it's also with the hope that as we help the family at 2 weeks, 4 weeks, 3 months, 6 months, and a year, and tap into, do you have any more needs? How can I help you? That we're also able to introduce, hey, we have an advocacy job. And hey, we have a communication group, and I heard you mentioned last time that you led the department on communication in this major government organization. Would you like to contribute? So it's an exciting way to take the pieces Ruth was talking about, those talents, and recruit parents as from when they walk in the door. I gotta say, we don't just parents in Idaho, we also pay youth to be at the table, and so that has become, that's still a challenge for us. Youth aren't going to call a support line and ask for help navigating the system. But they do come to our drop-by space. They do join our youth move groups. And so we're able to get youth voice in that space by going out to them. And we're still trying to figure out what that means and what that looks like. And then also advocate for them in places they need it, in places where they're getting support, mental health support. And we're also able to ask them, can you be on this committee? You know, I've noticed you're really good at this. And we've just this year, our youth programs coordinator built a leadership team. And I really think that we'll be able to raise leaders out of there to come to the state table too. And making it appropriate. So it's interesting for families, and making it, that Ruth talked about the acronyms and those pieces, but there's a lot of pieces to making it appropriate for being trained to be on that work group, but still be family friendly, and training not just the parents, but the work group lead, maybe the government employee. So that's important too. We also like to find that best fit. Like I said, that through getting to know the parent and through supporting them, maybe I'm attending meetings with them, or maybe I'm helping them to find their services that they need and teaching them that. We find out about who they are and find out what do they really like. It's not easy to find a statistician, right? So finding a parent who has these certain talents, it's gold. And so we ask them, can you be a part of this? And then what is their experience? So that can they be a lead? And you'll hear from Rainey, you know, she has a lot of leadership experience and what she's gotten to do with her positions. We also support parents as they go to the committee. How fast do I have to talk? It's 4:02. We also support parents as they go to the committee. So for example, I'm going to keep using this communications group, but I might have a family who I introduce to the communications lead of that work group, and we come together and I introduce them and they get to ask questions, and it makes sure it's a good fit, that the leader gets to be a piece of picking that parent, as well as the parent gets to say, you know, I'm not comfortable with this group. This isn't what I like after trying it out. So we try that, find that best fit and train them. I might go to those meetings for a few times in order to support that parent. And then after we see that they're able to launch, find out and just check in after those meetings. So kind of gives a different support in that. We also keep checking in with the parent. We keep engaging with the parent. And then we often, I think of one family who started and they said, wait, you take kids? Can my daughter attend this group with me and be paid as well and be a part of that? So we're able to grow families and families' voice into the system through a single family, through multiple families, and do it that way as well. All right, any questions online or anything? Go ahead. Wait 1 second. I'm going to give you the microphone.
So when engaging parents and youth, how are you meeting the parents and the youth where they're at? So how are you facing the challenge of having them be partners within the policy, within these meetings, within their schedule, right? Because we always need to remember to meet parents and youth where they're at, and they cannot always be at 11:30 meeting because they have work and school and other commitments. So how are you facing that challenge?
So we don't particularly have control over the time the leader sets the group for many groups. For Rainey's group that she'll talk about in a little bit, we chose lunchtime because that's when parents can make it. It probably will never be when. It'll be rare for a kid to be able to get out of high school and check in for, that's going to be tough. But we could get youth voice other ways. We can get them at the table in other ways. And I think that's true of parents too. So part of that best fit is, what is your availability? We're a very small program. So how can we meet the most needs. So, and train those parents. I'm also thinking, and we've been talking about this during the conference, like so now we have parents at a work group, and what do we do? If we had more leaders, you know, which comes first, the chicken or the egg? And maybe you guys have good ideas of what you've done, is that if we train a bunch of leaders and they're just sitting waiting for work groups, that doesn't work, right? We lose our leaders. On the other hand, if we wait and get a call just as we're leaving the door that we need somebody by Friday from another part of the state, that also does not work, right? Because we want to train them and prep them and come alongside them, train them to tell their story at the table. So there's that tension. So finding that good time, finding all those pieces are factors of whether you'd want to be on which group, right?
Can I add to that for a sec?
Yeah.
It's a really good question, and it's one that we struggle with in Idaho in terms of we're asked to get used to committee meetings all the time. And I just don't even take that seriously anymore, to tell you the truth, because what youth, it just doesn't even feel right to ask a single youth usually to take time out of their school day or whatever their day is to go sit with a bunch of adults just so they'd be asked like 1 or 2 questions maybe, or sometimes, I mean, unless we've really trained a group well, they might be there more as a token, and the people there think that they'll just pop their youth voice in. But that's really uncomfortable for a lot of parents, just like it is with parents. We've got to really prompt them. So I think what Michelle has done really effectively is hold focus groups that give parents a convenient time, because she always asks, when will this work for you? And we've done it with youth too, to come together, provide some voice on a specific topic that an agency or a work group is interested in. And that works much better. They're in a safer environment. They're just with other parents or other youth and us. And so that to me is one of the best ways to bring some youth and parent voice to a system, when the system is not terribly accommodating of parent schedules or understanding of them. But I also think it's really important, I'm sorry to keep talking. It's really important to be teaching the system as you go. We had an example this week of us needing to remind our system, you come to us for parent voice, you're circumventing the process by which we could get you a good parent and make sure that this parent has a good experience as well. So we can follow them. And they were sort of saying, oh, we know there's this parent over here and this parent there, so we'll just pull them into our committee. Well, that doesn't let them be supported by us. So we're constantly reminding our system who we are, what we do, and why it's important to support parents in bringing their voice, and certainly youth as well. Sorry.
No apology. We also have a unique challenge. I was just standing here thinking, is this true of any other state? We have 2 time zones in our state. Are there other states with that? Rainey will know that trivia. Okay. We have 2 time zones. So that creates another challenge, right? Saying it's a lunchtime meeting in Northern Idaho is different than Southern Idaho. So another piece of that time is different. And much of the government is in Southern Idaho. So that makes a challenge to that. So, all right. Oh, thank yous go a long way. I keep using this this communication group because it's easy because leads our group well. He leads the communications group well, but thank yous go a long way. As soon as I hear a parent say, oh, I worked with this person and they really listened to me, or they asked me questions, I write them a personal email, maybe a note, but at least a minimum, a personal email to say, thank you because you heard parent voice. Thank you for listening and asking, because that thank you goes a long way as far as cultivating a culture where we're going to get parent voice back to the table. We like to be thanked. But vice versa with the parents, right? Thanking them for bringing their voice to the table and making an impact. And then when there's issues, coming back around and saying, hey, were you heard? How can I make sure? What are your opinions about this issue? Were you able to speak up? Because some people are more easily to be outspoken at a group, and other people like to process. I like to process things and wait and think through things, right? So that makes it differently. how they interact differently. We also make sure that we're collaborative. That idea of bringing the parent to the table and saying, hey, we want to introduce you guys. Let's see if it's best fit for both of you. How does that look? And like we said, we're able to pay our parents, so that helps motivate, and youth, pay them to come to the table. Partner with new parents, with experienced parents. This has become really important. There's only so many places I can be at once, right? We all have this problem, but I can't go to every work group and be coming alongside every parent, but we have parents who over the time have been working on these work groups and even helped to stand up this system. They're gems to come alongside other parents to both say, hey, you did a great job, and to say, hey, next time, or here's a way to tell your story, and even just modeling, right? We learn so much through modeling, and parents can learn that way. So I think, all right, now it's Rainey.
It's me. I'm Rainey Bowles. I am the parent voice that is here with the group. We have a lot of other parent voices, but I'm the one that's here. I'm also the board president, and I don't stand behind podiums because I'm short. And I'm pretty active. I'm the hyper one. I have 15 kids. 11 of our kids are adopted. All of our kids have had some kind of trauma. The first 10 kids, ages 31 to 42, yes, 10 kids between 31 and 42, all of them are out of the house. And then lo and behold, we thought we were going to do other things, and our grandkids came into care. And we have had our 5 grandkids for 8 years now. They are currently 7 to 14. All of them came to us with not only SED, serious emotional disturbance, but they also have complex trauma, genetic issues, metabolic issues, and all 5 have autism. So it has been quite the journey. Trying to figure out, first of all, Medicaid. I had never dealt with Medicaid before with all the other 10 kids. All of a sudden, I'm trying to navigate Medicaid. This has not been easy. I have no idea how to deal with this department, that department, and this department. And yet I work for Medicaid because I'm also a trainer for foster care, and I am a mentor and a coach for foster care. I work for 2 different departments under a foster care CPS division. And here I am finding out, oh, Department of Behavioral Health and Children's Mental Health don't talk to each other. How do I do this? Michelle, who had come along beside me and taught me about TBRI, Trust-Based Relational Interventions, out of Texas Christian University, was a godsend to me, because now I had a way to communicate with these kids with trauma. That was great. If all they had was trauma, we probably would be doing well. But no, we're dealing with serious mental health issues here, along with all of these other issues. So we've got DD, LD, and we also have the mental health. So it has been an interesting journey, and there has not been a straight path. It isn't even like a mountain path. It's more like a spaghetti bowl that has too many ends and you can't connect them. But finding my parent voice at the table was helpful, because all of a sudden I was able to tell them things that were working, not just for my family, but for the foster care system. And more importantly, what wasn't working. There were so many things that they didn't even know about. There's a piece of the manual that had been written incorrectly, which made foster parents think that they were supposed to get a service that wasn't even available to them because they weren't going down the right path. It's available if they go down the right path, but it wasn't in the right place. So nobody knew how to access it. They wouldn't have known this if it hadn't been for Parent Voice. There's just a lot of different areas where I found that different parents have been able to come in with their experiences and share why something wasn't working, or how it impacts their family in a negative way or in a positive way that can let the policymakers make those changes. We can bring up things they hadn't thought about before that they may need to go clear back to the legislature to fix, right? Part of that impacts our foster youth. Our foster youth have a hard time accessing some services because of some of the ways the policies are written. So I came along and I joined quite a few groups And it was good. I really enjoyed it because I felt heard and I felt empowered. But more importantly, I started to see who the players were and how those different departments were accessible. And I think I've learned more about how to connect those pieces sitting at those tables than I ever did trying to figure out the navigation in any other way. And now I've been able to go on and help foster parents learn how to navigate those systems and some other parents. And it's definitely helping to make a bumpy path, but a better path, a little bit smoother journey for them. I'm currently the co-chair of a group now called the Family Advocacy Meeting that sits under our state programs. And it's a place where parents can come and we can talk about ways to engage at these tables and how to support each other and barriers we might be facing. And we're still having a rocky time there because every once in a while you find little pieces of state policy that impact that. Like we can't get a static web address or WebEx meeting for every month to be the same, which hopefully by January is going to be the same for a year, which made getting flyers out hard. So parents couldn't join us. And those meetings are at noon. Why? Because the state has to be at the table. The state doesn't work after 5 very often. So it is hard sometimes to find a way to do that. It is nice that I can be home and be getting paid to be doing something proactively for my kids and for other kids. I do have to sometimes, work around my own schedule to make these things fit in, but it's important to me. And I think that a lot of the parents, if it's really important to you, you're going to try your best to find a way to do that. We do have the 5 kids at home, and hopefully someday maybe some of them might be able to have a place at the table for parent voice as well. Not quite sure how that's going to work yet, but I think that some of them might be able to do that. I think that the most important thing that I have found is you don't have to be a professional speaker. You don't have to have a college degree. You don't have to have anything very specific, because you have a story to tell. You have your lived experience, and your lived experience is something that a lot of them don't have. And that's a piece that they're missing. So when we're able to bring together our different pieces, that's helpful. We're still on the trauma, but yeah. My brain had too many tabs open when I was looking to find all of these pieces, right? I was getting information from the internet and trying to find the navigation for mental health, and we just couldn't find it. And so I had too many tabs open and I needed to keep looking. We can keep going. Yep. And so that's where our lived experience and the professional experience come in together. Now, I'm lucky. I do have the foster parent piece. So I have that piece of the expertise to go along with the lived experience, but a lot of the families don't. And just being able to come to the table with the people that do have the expertise and their lived experience creates those puzzle pieces coming together and creating a clear picture and being able to have that whole scheme. And then the last piece is, if we don't tell them that it's broken, if we don't tell them that something's wrong, they think it's okay and that we're okay with that. So if there's a problem, you need to speak up. Please find your voice, find those people who have problems, bring them to the table and let them tell why it's not okay so that it can be fixed. And that's all I've got for you, but we are open for questions.
There was a question online. I'm going to answer that and then I'll come over there. Is family voice is important? And many times we have great voice that wants to advocate for policy change. But what I have seen is many talk about the importance, but do not utilize the voice with purpose and intent. How do we change this? So I think it's really important to think about what our end goal is and build backwards. Like before I was there, we had Ruth built the family support line, right? And so that gave us a gateway to start gathering parents, and our end goal is to have them at the table. But when I got there, the in-between steps we didn't have, right? So we can build those in-between steps, and then training those parents to tell their story. The story Rainey told you may be a different story to a policymaker at a different time who's on a specific issue, and maybe a different story at a work group for a specific issue. So training parents to tell their story, I think that's how we get value, is by coaching them and training them. And we just keep showing up with parents, and we do our best to bring those parents to the table, and we represent it with data, sometimes with lots of parent voice, and sometimes we do it with individual stories. So who the audience is, how we can walk parents along that ladder, for lack of a better word, right? Those sorts of things. All right, I'm walking out of the magic square that you guys online can see me.
So I know you, the last slide said, speak up. Yeah, okay, so what happened when we speak up, what I found in my lived experience, because I am too fortunate to be a professional counselor, but also have a lived experience, and saw that it was a battle. And that's why I'm here, because it's like, if I'm having trouble and I know the ins and outs, I know the shadiness, I'll say, that happens, and I'm having trouble, then I can imagine what a family who has no background, education, no experience with these things. And when I spoke up, I was spoke over. So here I am, and then I go then now you have the regional, and I knew to go up the chain until I got to the regional director, and I said, you know what, forget it. Right. And so, and he's like, well, you can go above me too. And I'm like, you know what, there's not this right here. That's when I said enough is enough, and became.
You are so right, because I think that I have to stand in the magic square. You are so right, because I think that sometimes parents feel devalued, understandably, because of the way they're being treated at that table. What I find is that I show up with the table with them. I have different lived experience. Mine comes out of sibling and raising my own kid, right? Different lived experience than that parent who's contributing on that group that we've chosen them for, but coming alongside them helps. So, and I tell the parents right off the bat, hey, look, if you bring me to the table, this is a piece of the collaboration. Those players know me, and we can work together, and I'll help amplify your voice. And so sometimes that means I turn to the parent and say, so if I'm understanding you, right, just repeat it. But it makes a different voice coming from a professional. And what's tricky is, you're right, like, you either get to be a parent or you get to be a professional at some of those tables. And so then it makes it trickier too, I think. Is that, all right, I'm stepping out of the square. Sorry, people out there.
I might have missed this a little bit, but when you first started about how people differ so much sometimes, and your job is to bring them together, how do you determine what you're going to focus on, like legislatively or systemically, right? So I work with families that are impacted by substance use, and there's such huge division. There's people that their kids died of fentanyl and they want to change the laws and make them stricter. And then other people that are like, that's not going to help and we need more treatment. Or for example, with, mental health supports, well, we need to have tougher laws for commitment processes. And then there's other people that are like, no, we need to engage them more, and we need to have better systems that will provide, connection and collaboration. So, when you get into this idea of collective voices for policy change, and there's such stark differences, and I mean, that attitudes are so different with different groups. And sometimes it's obviously because their experience was so much more, they had tragedy, right? A lot of these voices come out of tragedy.
Yeah, that's a really good point and a good question. We definitely are faced with a big variety of very passionate parents. And so we do a couple of things around that. We had an organization that we helped to sort of stand up. They were not under us. They were not part of our federation, but it was sort of a collaboration with our Department of Behavioral Health, that we wanted to bring more parent voice. And so there was a group, they were called the Idaho Parent Network. I say were because it's just a little unclear where they are right now, but the idea of them was that they were a group of parents who could be really passionate with each other and find other parents who really wanted to bring voice and action to a certain issue. So that gave them some support players in doing that. They could say as a network, we're all going to vote together to bring our voice to the following issue. What we've done as a federation is basically we collect data from all the calls that we get. You know, almost everybody could have a family support line, because I can't imagine all your organizations aren't constantly taking calls from parents who are like, what do I do? What do I do? So when I arrived at the Idaho Federation, that was what was happening most of the time. We were getting calls and we were figuring out what staff is the best person to take this call and help this family. And I thought, but we weren't saying that we did anything. And I basically marketed, for lack of a better word, though I don't love that word, it as, well, that's a service. That is our service that we do. And I need our state and our system to understand we're providing a service. So I needed to name it something, essentially. And we will do that service until the state decides, okay, we really need to have people helping families navigate the system, because we truly are like navigators of our system. And we can always have a family support line. I wish we didn't have to do so much navigation, because I do think that the state should be figuring that piece out for families themselves. They give us a little money to do that, but so we take all the data that we get from those phone calls and we look at what are we hearing the most? What do we just basically make a judgment? We try and come together annually. We just started doing it a year ago. We took actually it was an 18-month period before that. And we said, we asked ourselves, what do we hear that whole 18 months? We were on a new contract for 18 months. What did we hear during that time? We need to present this information back to our state players. These are some of the issues we need to bring family voice to. So out of the many, many, many issues that we heard, we probably had a top close to 10, 8 to 10, that really we were hearing with enough frequency that we felt like it really was beholden on us to make sure to bring voice to those issues. Whether we had realized them beforehand or not, the fact that they were happening repetitively across our state and or to certain populations in our state, that's what we decided to really bring our voice to. Now, we also have community partner organizations. And right now, because the Idaho legislative session is January to March, right now, those community partners are starting to meet at least a couple times a month, most of them. And we're talking to each other about what do you see on the radar? What legislation is coming that we need to support? What legislation is coming that we need to fight? What legislation do we need to find a champion for? So we work on things that way as well, listening to what our community partners are saying are happening out there. And then we have the chance to bring voice to our community partners to say, you know, in youth mental health, this is going to be essential. Parents are suffering because of this piece of legislation that did not get enacted well. We need to do something about that. So tough choices, but I think it's always a good thing when parents also have their own energy for something that we try to promote them. We might say in a newsletter, hey, parents who are interested in the following issue, contact so-and-so. So that a parent can build a little community of people that want to help them work on an issue.
Did you have a question?
Oh, no, I know it's time, so that's okay.
Yeah, it is time.
I did want to just quickly say,
I'm sorry.
I will appreciate you that I also sit in a position where professionally and a parent, there's times where I sit in and I sit like a hat. I flip this hat around because this is my parent hat, and then I flip it back because this is my professional hat, right? And in the system. And there's sometimes those blurred lines. But one thing about it is when we come together more and more and more, just like we say, 1 penny, 2 pennies add up to $1, right? So bringing all of the voices together also helps support, as you can be able to switch your hat to that system and say, but I have these parents right here that have a voice as well. And we're coming together when we're trying to promote those voices. So I definitely want to make sure I want to share that. The other thing I think is really important, what you're saying and appreciating about, you know, there's sometimes a battle, like you were saying, around parents, that energy they put into it, that if they've been affected by it, someone that they have lost because of suicide or something. And then there may be another side with someone that maybe experienced some big behaviors under mental health issues. So how do you support them? You support both of them. And I think communicating that it's not a battle, but we are all here. And so sometimes we may have to push, we may have to bring some issues to the forefront legislatively, and then the next time we'll look at this. But in the meantime, we'll still continue to be able to support one another in other capacities. And I think that's where we continue to be strong voices as parents together. So
those are great final thoughts for us. Thank you so much.
One thing to make sure, let's see if there's anything online. Nothing. Good. All right.
I just want to thank everybody for being here in the room and people online. We love being in this work with our colleagues. Coming to conferences like this is so special and meaningful, and really just creates even more and more energy for the work that we do. So thanks to all of you.